Hi, I'm Paula Davis-Lack, Doctor of Nursing Practice. We're going to be doing a full head-to-toe for Eastern's Health Assessment 220. I have my patient here today. Can I get your full name and date of birth, please, sir?
John Doe, January 1st, 1950.
All right, John Doe. And today we're going to be doing a physical exam. You are the patient that I was looking for. So during this exam, I'll be touching charts for your chest, your back, your belly, your legs and arms. Any questions with that? Any issues with touch on those areas?
Nope.
Do I have your consent for this physical exam?
Yes.
All right, we've confirmed our patient with his 2 patient identifiers. We've obtained consent, so we're going to go ahead and do the physical exam. All right, sir, we're going to start with a neuro assessment, which will continue throughout the exam. Also, the skin assessment will be done throughout the exam, so if I see any abnormalities with your skin, I'll just kind of call it out as I go, okay?
Mm-hmm.
So first and foremost, where are you today?
Ann Arbor, Michigan.
Okay, and what year is it?
2023.
Who's the president?
Biden.
And why are you here?
Physical exam.
All right, wonderful. So patient is A/O times 4. We'll continue to assess his neuro system. All right, I'm going to shine a big bright light in your eyes. Okay, and follow my pen light in. All right, Perla is intact. Pupils reacted lovely from 5 to 2, nice and brisk, and his eyes did both accommodate well. I'm going to check his cardinal gazes. Follow my pen light with just your eyes. Thank you so much. Great. Cardinal gazes are intact, which also tells us that cranial nerve 2, 3, and 6 are intact. All right, go ahead and give me a big smile, big frown, stick out your tongue, move it side to side. All right. So with that, we can assess that cranial nerve 7 is intact, as well as cranial nerve 10. Go ahead and open your mouth and say ah. All right, lift up the tongue. Okay, great. His mouth looks good. No redness or anything in the back of the throat, no exudate. His oral pharynx was nice and moist. There was no thick coating on his tongue. All right, I'm going to go ahead and assess your sinuses and then your lymph nodes, okay? So I'm going to check your frontal sinuses, maxillary sinuses, preauricular lymph nodes, postauricular, submental, suboccipital, posterior cervical chain, anterior cervical chain, supraclavicular, anterior cervical chain, supraclavicular. Go ahead and shrug your shoulders. All right. So there was no inflamed or enlarged lymph nodes. There was no tenderness or bogginess, no pain with palpation. And also with the shoulder shrug, we can assess that cranial nerve 11 is intact. All right, sir, I'm going to continue on by listening to your heart, okay? Oh, I'm sorry. Actually, no, I'm going to assess your trachea first. So here's your trachea. It's nice and midline. I'm going to feel your thyroid. No thyroid megaly, no palpable nodules. Okay, go ahead and swallow for me. And say ah. No vocal change to quality after a swallow, so he is safe to swallow. And then I'm going to assess his carotid bruits. So for this, I'm going to switch to the bell of my stethoscope. And when I place my stethoscope on your, take a big deep breath in and hold it. All right, go ahead and let that one out. And then deep breath in and hold it. Great. So no bruit on bilateral carotid, so I'm going to flip my stethoscope back to the diaphragm and listen to his heart sounds. Just breathe nice and normal. So that was his aortic, pulmonic, Erb's point, tricuspid, point of maximum impulse, and mitral. All right. S1, S2 without click, murmur, or rub. I'm going to go ahead and continue with his chest assessment by listening to his lungs. Every time I move my stethoscope, take a big deep breath in and out through your nose for me, okay? You'll be taking 6 on the front and 8 on the back. So if you need a break, please let me know.
Okay.
All right, go ahead. Up and under. Up and under. I don't remember if I listened to the spot, so I'm going to do it one more time. Great. So all anterior lung fields clear to auscultation. I'm going to go ahead and palpate. Okay. No lumps, bumps, nothing that I'm concerned about. I'm going to go ahead and percuss. All right. He had no palpable heaves or thrills. He also had no dullness or hyperresonance to percussion. All right. So we finished your anterior chest. So I'm going to have you flip around so we can do your posterior chest assessment. Oh, I'm sorry. We did forget egophony and bronchophony. So go ahead and say EE and 99 for me.
EE 99, EE 99, EE 99.
All right, now we're going to have you flip over. Thank you so much for reminding me about that. All right, so this side we're going to listen to 8. So again, give me a little hand up if you need a break.
Okay.
Big deep breath in and out. So that was 4, so we could give him a break, but it sounds like he's doing just fine, so we'll keep on going. Two more. Last one. Great. I'm going to, all lung sounds posteriorly were clear to auscultation. I'm going to go ahead and palpate. All right, no extra lumps or bumps that I'm concerned about. I'm going to go ahead and percuss. I'm going to go ahead and thumb on your kidneys. All right, so there was no dullness or hyperresonance to percussion. There was no CVA tenderness. I'm going to go ahead and assess for bronchophony and egophony. Go ahead and say EE and 99 again.
EE 99, EE 99, EE 99, EE 99.
So I did feel a little bit extra tactile fremitus with my right hand, so I'm going to flip my hands just to make sure that my assessment was accurate. So one more time.
EE 99, EE 99, EE 99.
Okay, so that felt a little bit more even. So it was just my own kind of sensation issues. All right, sir, so we're going to go ahead and have you flip over, and I'm going to continue with the physical exam on the front side, okay? All right, and so throughout this whole time I've been assessing his scan. I'll continue to do that throughout the physical exam, but so far up through the thorax into the arms, I've seen no concerning lesions. So I'm going to go ahead and assess your radial pulses. Both of those are +2 bilaterally. Cap refill is less than 3 seconds bilaterally on upper extremities. I'm going to go ahead and flip the camera so you guys can see my pedal assessment. All right, so here are his feet, and I'm going to assess his dorsalis pedis, posterior tibialis. Those are both +2. No pedal edema, no pre-tibia edema. Toes up to your nose. Push down like you're pushing on a gas pedal. Wonderful. Lift the knee straight up. Don't let me push you down. This one. Great. Let me just double check your, okay. Okay. And you have no lesions that you're concerned about. Okay, so we can go ahead and finish up with the neuro assessment and go ahead and squeeze my fingers as hard as you can. I'm gonna pull, you resist me. I'm gonna push, you resist me. Wonderful. So all extremities are +5, dorsiflexion and plantar flexion. We're both intact. Again, no concerning lesions. So we're gonna have you lay down for me.
Okay.
And I'm gonna do your abdominal assessment.
Okay.
All right. I'm gonna uncover your abdomen, take a lick, a listen, and a tap. All right, I'm gonna listen. My stethoscope might be a little bit cold. All right, bowel sounds were a little either normoactive or hyperactive, but I'm going to consider them normoactive since they weren't gurgling excessively in all 4 quadrants. I'm going to go ahead and tap. All right, no hyperresonance or dullness to percussion. I'm going to go ahead and lightly palpate. Okay, no pain with any of that? All right, I'm going to go a little deeper. Okay, great. Any pain with any of that? All right, I'm going to push right above your pubic bone. Great. I'm going to go ahead and listen to your abdominal aorta. All right. So that completes our abdominal assessment. So again, he was normal, active in all 4 quadrants, no tenderness to light or deep palpation, no hyperresonance to percussion, no suprapubic tenderness, and no bruit on the abdominal aorta. So while you're laying here, we're going to finish up the neuro exam by playing a little game. So you go ahead and close your eyes. It's called Am I Touching You? And then you have to tell me whether the sensation is dull or sharp. Any questions about our game? Okay, am I touching you?
Nope.
Am I touching you? Is it dull or is it pokey?
Okay.
All right. Am I touching you?
Yes, sure.
Am I touching you?
Yes.
Sharp or dull?
Sure.
Am I touching you?
Yes, sure. Yes, sure.
Okay.
Yes, dull. Yes, faintly. Yeah, sure.
Okay. Lower extremities?
Yes, sure. Yes, sure.
Okay.
Yeah, sure.
Okay, so he did have a couple abnormals. He wasn't able to tell on his left hand between dull and a sharp sensation. So that's we would, if we had any concerns about that region, we would want to assess it further. But are you concerned with your sensation at this point, sir?
No.
Okay, go ahead and sit on up for me.
Am I dying?
No.
Okay. Just check.
All right, so I'm just gonna go through and make sure we did everything and tell you everything through our assessment. So we were able to tell that his nervous system was intact. We checked cranial nerves 2, 3, and 6 with his eyes. We checked cranial nerve 7 and 10 with his mouth. We checked cranial nerve 11 with his shoulder shrug. His nervous system was further intact with +5 strength in all extremities. Here we have his support animal coming to visit. The only abnormality we did have is a little bit altered sensation in that left hand. Otherwise, his sensation was intact. His abdominal assessment was completely normal. Normal active bowel sounds, no hyperresonance percussion, S1, S2 without click, murmur, or rub. Anterior and posterior lung fields were clear to auscultation with no heaves, thrills, hyperresonance, or dullness to percussion. No agophony or bronchophony, both anterior and posteriorly. All pulses were +2, bilateral upper and lower extremities. All right, sir, any questions about our physical exam or any of our findings?
Nope.
All right, well, thank you so much, and you have yourself a wonderful day.
Thank you.